You have to be able to assess situations when seconds matter. You have to be able to make those split-second decisions to determine if a person is in danger, if they're breaking the law, if they are under the influence, or in need of medical treatment. It's important to note that people with certain types of seizures may exhibit behaviors during or even after an event that may affect a person's awareness, behavior, or ability to communicate. First responders must be able to recognize and respond properly during a seizure and prevent adverse health events or inappropriate law enforcement actions. Behaviors resulting from a disability, such as epilepsy, should not be criminalized when no crime has been committed. You need to be able to recognize that an individual having a seizure is unaware of their actions and needs help. They need your help. Our goals for today include increasing your awareness and recognition of seizure disorders, reviewing seizure safety and first aid recommendations, supporting the first responders priority, and protecting the rights of the individual having a seizure. Ensuring that you understand the importance of maintaining consistent access to seizure medication for people with epilepsy. Specifically, our learning objectives include describing the difference between a provoked and unprovoked seizures, identifying types of seizures and their features, their symptoms, identifying reasons why a person may need transport to a hospital after a seizure, and describing key steps in first aid for a person during a seizure with impaired or loss of awareness. Let's begin with the foundation. What is a seizure? On a regular day, your brain is sending electrical signals to the body. It's doing this so you can move, think, feel, do anything that you need to do on a regular basis. Imagine if those signals were scrambled or disrupted in some way. When this happens, we say that a seizure has occurred. A seizure is a brief moment of excessive electrical activity in the brain. So a brief moment of excessive electrical activity in the brain. There are actually more than 20 different types of seizures. And these seizures may affect one or more of the following. It may affect movement. So there's one type of seizure that we call a tonic-clonic seizure. This is a type of seizure a lot of people think of when they think of epilepsy, but it's only one of the 20 plus types. This type used to be called grand mal, but they have since changed the name to tonic-clonic. So this is a type of seizure where you would see the person shaking pretty violently, or what we call convulsing. This involves movement. We can see that. But there are certain types of seizures that do not involve movement. There's also some types of seizures that affect behavior. It may even affect behavior in such a way that the person may mimic behavior of someone who's intoxicated or under the influence. But for that person, it's simply a seizure that has affected their behavior. There's some types of seizures that affect awareness. So there's some types of seizures where the person is fully alert and fully awake and aware while it's happening, whereas there are other types of seizures where awareness is impaired or altered. There's some types of seizures that affect sensation as well. An interesting thing is that 1 in 10 people will have a single seizure in their lifetime. 1 in 10 will have a single seizure in their lifetime. This doesn't necessarily mean that they have epilepsy per se, and we'll define epilepsy soon. Let's talk about the major groups of seizures. There are two major groups. So there are provoked seizures and there are unprovoked seizures. For provoked seizures, these are seizures that are provoked by an acute insult or injury to the brain. One major characteristic of this type of seizure is that once the acute illness has been resolved, the seizures do not recur. Whereas for an unprovoked seizure, seizures may occur without an immediate provoking cause. And the tendency to have recurring unprovoked seizures is defined as epilepsy. So that's what we define epilepsy as. Factors that may provoke seizures for some people. It could be a very high fever, or what we call febrile seizures. We see this type of seizure especially in children. For some people, if they have a fever or if their temperature spikes too high, it may provoke a seizure for them. For others, it may be due to drug use or alcohol withdrawal, lack of oxygen to the brain, whether due to near drowning or another cause, traumatic brain injury, brain tumors, brain infections, stroke, dehydration or hyperhydration, or complications due to medical conditions such as diabetes, pregnancy, or other acute medical illnesses. Epilepsy is a brain disease. We define it as 2 or more unprovoked seizures more than 24 hours apart, It may also be defined as one seizure with high risk of recurrent seizures. So if this person has had a seizure and that healthcare provider, the neurologist, whomever, has determined that this person is very likely to have recurring unprovoked seizures, then this person has epilepsy. Diagnosis of an epilepsy syndrome, and tendency to have unprovoked recurring seizures not caused by any known medical or treatable condition. The term epilepsy means seizure disorder, but seizures are not always due to epilepsy. Keep this in mind. For 70% of people who have epilepsy, the cause is unknown. They don't know why they have it. For 70% of people who have epilepsy. For the other 30%, common causes we see include birth trauma, traumatic brain injury, stroke, brain tumors, brain infection, and sometimes genetics may play a role as well. But again, for 70% of people, they don't know why they have it. Epilepsy is way more common than most people realize. 3.4 million people in the US have epilepsy, 65 million worldwide. So if that's you, or if that's someone that you know, you are not alone. There's a lot of people who have epilepsy. There's a lot of people who think that only kids can get epilepsy. This is not true. Epilepsy can happen to anyone at any age. The reason that they may think this is because about 50% of epilepsy patients are diagnosed before the age of 10. However, epilepsy can happen to anyone at any age. It also does not matter their ethnic or racial background either. I mentioned that 1 in 10 will have a single seizure in their lifetime. Well, 1 in 26 will have epilepsy in their lifetime. So 1 in 26 will have recurrent unprovoked seizures in their lifetime. Every 4 minutes, someone has a seizure. And epilepsy is more common than some of the most well-known disorders that we know. So it's more common than cerebral palsy, MS, Parkinson's, and autism combined. Epilepsy is the fourth most common neurological disorder. This is after strokes, dementia, and migraines. And over 400,000 Floridians have epilepsy. Over 90,000 of those are children. Actually, as of right now, approximately it's 474,000 Floridians. 94,000 of those are children. Let's dispel some myths. A lot of people think that epilepsy is contagious. The fact is, epilepsy is not contagious. It is about as contagious as a gunshot wound, is what we say. A lot of people think that only kids can get epilepsy. Epilepsy is not just a childhood disorder. A lot of people think that epilepsy is a form of mental illness. Epilepsy is not mental illness. A lot of people think as well that epilepsy is an intellectual dysfunction. Epilepsy is not a cognitive disability or a sign of low intelligence. Some people think that someone having a seizure will swallow their tongue. You can't swallow your tongue during a seizure. The tongue is attached to some pretty powerful muscles. It's not going anywhere. However, you do want to get them on their side. Don't leave them on their back, because if the tongue is blocking the airway, when you get them on their side, it's able to move away from the airway. A lot of people think that flashing lights can cause a seizure. The fact is, flashing lights can cause a seizure, but only in about 1 in 100 people who have epilepsy, so not as common as most people think. People with epilepsy may have one or more other disorders, or what we call comorbidities. Because of this, diagnosis of epilepsy may be difficult. This may lead to misdiagnosis, and as a result, inappropriate treatment may be administered. Problems affecting emotional health and behavior are most commonly depression, emotional instability, and impulsivity. There are certain things that could trigger a seizure. For some people, they don't know what their trigger is, but these are some of the common triggers that we know of. Stress can trigger a seizure. Overstimulation, excitement, hyperventilation can trigger seizures. Excessive heat and dehydration. So for this person, maybe they wouldn't be out in the sun as much, or maybe they would try to keep hydrating themselves throughout the day. Fatigue or lack of sleep. For that person, they need to make sure that they get enough hours of sleep. Illness, extreme heat or cold, flashing or flickering lights, and alcohol and drug abuse. Stress can trigger seizures. Stress is an expected and unavoidable part of life, unfortunately. We all experience stress in some way or form throughout our life. However, stress is frequently reported as a seizure trigger. So it's a trigger for a lot of people. It is our body's reaction to any change that requires a physical and emotional response. It may lead to worry, depression, frustration, and even anger. It may trigger hormones that affect our mood and behavior. It may lead to sleep problems. And being anxious and depressed can also worsen stress, causing a vicious cycle with more seizures and mood problems. For some people who have epilepsy, even alcohol in small amounts may be a problem for them. Withdrawal after large amounts of alcohol more likely to result in seizures. Risk of seizures may be much higher after having multiple drinks, and rate of drinking alcohol may affect seizures. Some studies have even shown that alcoholism or chronic abuse of alcohol is linked with the development of epilepsy in some people. Seizures have a sudden onset, a progression of symptoms, and a gradual recovery. Intoxication, on the other hand, begins slowly and takes much longer to end. If an intoxicated person has a seizure, strong odor of alcohol will be evident. The person's return to consciousness or after the seizure won't be as obvious and may be at risk for prolonged or repeated seizures. Whatever the cause, the seizure needs to be managed properly. Other care for intoxication may be needed as well. I mentioned there are more than 20 plus types of seizures. Those 20 plus seizures typically fall into one of two categories. Either it's going to be a focal seizure. This means that only part of the brain is involved in this seizure. Or it's going to be a generalized seizure, which means the entire brain is involved in that seizure. Within focal, there are focal aware seizures. So as the name implies, the person is aware while it's happening. They are fully alert and fully awake while this type of seizure is happening. They may have isolated twitching of the arms, face, or legs. They may have sensory symptoms. You may hear that person say, I smell something that no one else is smelling. I hear something that no one else is hearing. I see something that no one else is seeing, or a sudden feeling of fear or a sudden feeling that they can't even explain out of nowhere. And then it's gone. It typically lasts less than 1 minute. It has a sudden onset and then lasts less than 1 minute. For that person, it may be a focal aware seizure. They are aware while this type of seizure is happening. For some people as well, a focal aware seizure may actually be a warning sign or an aura for another type of seizure. So for some people, it starts as a focal aware seizure and then progresses to other types of seizures. There are also focal impaired awareness seizures, which we'll talk about in more detail. But for a focal impaired awareness seizure, as the name implies, the person's awareness is impaired, or for some, it is altered. They're not aware of what's happening around them. There's an inability to respond or react. That within the generalized category, there are absence seizures. So this one looks like the person is daydreaming. It looks like the person is zoned out. The difference here, however, is that if you try to call them, you try to get their attention, they're not going to respond or react to you because for this person, they are not aware of what's happening around them. Their awareness is impaired for this type of seizure as well. For a tonic seizure, the body gets very rigid. For an atonic seizure, there's a sudden loss in muscle tone. So for this person, they could be walking maybe down the street and all of a sudden you just see them drop. There's a sudden loss in muscle tone for this person. We also call it a drop attack. There are also myoclonic seizures. For this, you'll see jerking on both sides of the body. So you may see both arms jerking. This type of seizure tends to happen more in the morning than any other time of day. There are also clonic seizures, which means that there's jerking taking place. And there are also tonic-clonic seizures, which used to be called the grand mal seizure. For this, the person gets very rigid and then they start jerking, or what we call convulsing. A seizure may appear as, specifically for a tonic-clonic, what used to be called grand mal seizure, a sudden cry followed by a loss of consciousness, and the person would typically hit the ground. They would get very rigid, very stiff, followed by rhythmic jerking, what we call convulsions. The person may have shallow breathing and drooling. They may lose control of bodily functions. Sometimes the skin, nails, and lips may turn blue, and it generally lasts anywhere between 1 to 3 minutes. Now, this is important because one of the seizure first aid measures is to time a seizure. If it's 5 minutes or more, they need medical attention. They need emergency care. After the person has stopped seizing, after they have stopped convulsing, they enter what is called the post-ictal or the after seizure stage. In this stage, the person may be confused. They may have a really bad headache. They may be very sleepy, want to sleep for some time, may be confused, may have speech difficulty. This is after the person has stopped seizing. They have stopped convulsing at this point. A seizure may also appear as blank staring, chewing, other repetitive, purposeless movements, or what we call automatisms. This is specifically for focal seizures with impaired awareness. The person is not aware of what's happening around them, but they're doing this purposeless, repetitive movements. It may appear as well as wandering, confusion, incoherent speech, crying maybe, screaming, mumbling, running, flailing. For some, it may be a sudden loss of muscle tone. They may fall. They may start picking at things, picking at clothes. They may try to disrobe themselves. They may be aimless walking as a symptom, which looks like sleepwalking. But the difference there is that if you try to call their name, try to get their attention in some way, they're not going to respond or react to you because that person is not aware of what's happening around them while the seizure is taking place. So focal seizures with impaired awareness. Because of this, it's often confused with drunkenness, intoxication, illegal drug use, medical conditions such as stroke or diabetic reaction, and signs of mental illness. This is not the case for this person. It is a focal impaired awareness seizure. If a person is suspected of having a seizure, you need to know, does this person have a known history of seizures or epilepsy? Find out from bystanders, what did you see? Are you aware of a seizure history for this person? Did the person announce that they were having an aura, a warning sign? Were they acting strange before it happened? Was there a sudden onset? Look for a medical alert necklace or bracelet. For a lot of people who have epilepsy, they might have a bracelet or a chain or something on their person that indicates that they have this condition. So look for it to see if that's why this is happening. See if they have anti-seizure medication on them as well. This would be a good indicator that this person either has seizures or they have epilepsy specifically. A person having a seizure with impaired awareness is unaware of their actions and unable to control their body. They may have impaired awareness or an altered awareness. There's an inability to respond to questions or direction from others. So you can't just tell them sit down because they're not going to be able to do that. You can't just tell them to stop if they're walking towards something dangerous. They're not going to be able to do that. Right? They may not be able to be capable of organized thought. It's important to note as well that some people may have impaired awareness, some people may have altered awareness. So the seizure may not affect their hearing per se, but they're not able to control their body or not able to respond to you. But they can hear what you're saying and they know what is being done to them in that time for some who have altered awareness. Clumsy, undirected, agitated resistance is possible when an individual is restrained during a seizure or in the period of confusion following. So although this person has an impaired awareness or an altered awareness, their fight or flight is still active. So if you are too aggressive to them or if you try to restrain them, they may actually push you or become more agitated themselves. The reason is because their fight or flight is still active. Their body has simply perceived you as a threat and reacted. And this is not intentional towards you at all, not intentional towards the first responder, law enforcement personnel. This is not intentional at all. The body has simply perceived you as a threat and they have reacted. So for this person, do not restrain them. Do not be too aggressive towards them because they may react, not intentional at all. When responding to a focal impaired awareness seizure, you need to maintain a calm demeanor. Do not verbally confront or physically restrain the person. As mentioned, for that person, it may be an impaired awareness or an altered awareness. So for that person, although they're not aware of what's happening around them per se, they are not able to control their body or react or respond. For some of them, they may be able to hear what you're saying. They may be able to know what was happening to them in that time, even though they couldn't do anything about it. Imagine being trapped in your body. That for some, that is their experience. Assess for return of awareness. Seizures of this type may last from seconds to 2 to 3 minutes, but may look like they last longer. See if the person is reoriented to their place in time. Do you know where you are right now? Do you know what year we're in? See if their awareness has returned. For a tonic-clonic seizure, the first step is actually to stay calm. If you are calm, you're then able to focus on everything else you need to do to be able to help that person. You want to time the seizure. We said it's usually 1 to 3 minutes typically, but if it's 5 minutes or more, that person needs emergency care. Clear the area of any objects or obstacles that may cause injury. So if there's something near to them that they could injure themselves on as they are convulsing, move that object from around them. Don't move the person if you don't have to. Move the objects from around them that might be dangerous. Protect the head. So cushion the head with something soft, right? They will be convulsing and probably hitting their head pretty hard. So try to cushion their head with something soft. Turn the person on one side. Don't leave them on their back. Observe for return of normal breathing as seizure subsides. Inform bystanders of what's happening. They're having a seizure. I'm just making sure they're okay, making sure that they're safe. And there's a lot of people that think that I should put something into their mouth because they're going to bite their tongue. So a lot of people have said I should put a metal spoon into their mouth because they might bite their tongue. If it's too hard, for example, a metal spoon, you might chip their teeth. Some people have said put a pencil. You might actually puncture their gum with that pencil. And if it's too soft, whatever the object is, if it's too soft, they might be able to bite it off and choke on it. So don't put anything in their mouth while they're having this type of seizure. There's a lot of things that we should not do when someone's having a seizure. Don't taser the person. Don't restrain or hold them. Don't put anything in the mouth. Don't leave alone until awake and aware. Don't give liquids by mouth until fully conscious. Don't keep a person on their back or face down during or after a seizure. And don't obstruct or block the airway. Very important. When is a seizure an emergency? A person should receive emergency care if it is the first time. If this person is not known to have seizures or a history of seizures, they need emergency care. If it's a convulsive seizure lasting more than 5 minutes, they need emergency care. If it's repeated seizures without regaining consciousness, more seizures than usual, or even a change in type for that person. If there is apparent injury, maybe they injured themselves on the way down, hit their head, maybe they need emergency care. If they have any medical condition such as diabetes, pregnancy, or any other medical condition. If the seizure occurs in water or fluid is aspirated, they need emergency care. And if they have problems breathing after the seizure has ended, they need emergency care then as well. Transport to an ER for medical treatment may not always be necessary. For people with known epilepsy who have a typical seizure and who are recovering, it may not be necessary for them. For example, Susan, it is known that Susan has epilepsy. She even has a bracelet that indicates she has epilepsy. And it's known she has it. It's known that she has tonic-clonic seizures. And on this day, she has a tonic-clonic seizure. It's been about 2 minutes. And yes, she's recovering now. Yes, she's sleepy, a little bit confused. She wasn't injured. She's not pregnant. None of those apply. That it may not be necessary for her to go to the ER. It is also not necessary if Susan happens to be with family or friends or caregivers able to assist her after the seizure ends, especially if they're familiar with her having these seizures and how to care for her after a seizure. So it may not always be necessary to take someone to the ER for medical treatment after a seizure. Medications can prevent or reduce seizures in 70% of people with epilepsy. Other options include surgery for some people, implanted devices, and diet therapy, one specifically known as the ketogenic diet, which has an anti-seizure effect for a lot of people. So some of these are able to help people with epilepsy. The main treatment of epilepsy is one or more anti-seizure medicine. Anti-seizure medicines work in different ways. It may decrease the brain's susceptibility to seizures or stop the spread of seizure activity in the brain. Many anti-seizure medications are available. There's no one size fits all. It really depends on the seizure type for that person, the onset, do they have any comorbidities, and any patient-specific factors as well. Medicines must be taken daily to keep stable amount in the body and brain. The person needs to take the medication on time, every time, as directed by their doctor. Some medicines may be given as needed to stop clusters of seizures and to prevent emergencies. People may carry their medication with them. So if that person has pills, tablets, or capsules in their possession, it should not be automatically regarded as evidence of illegal drug use. It may be their anti-seizure medication. If someone is taken into custody, ensure that the medication is given on time. Do not suddenly stop their anti-seizure medicine. They may start seizing, and this may be fatal for some people. Find out when rescue medication is needed if it's needed for this person. There are also medical devices that some people may have. They may have a vagus nerve stimulator. This is a device used to help control seizures. The device is implanted just under the skin in the chest with wires that attach to the vagus nerve in the neck. It's a circular device that's usually located on the left side below the collarbone. It's within the chest, but it's usually on the left side below the collarbone. This person will also have a magnet on them. Some people wear it on their wrist, on their belt, maybe in their bag. When they're having a seizure, you would need to grab the magnet and swipe over that area to abort or lessen the intensity of the seizure. What you would do is swipe the magnet over that area, so left side below the collarbone. You wait a full minute. If it has not subsided, you swipe again. Wait a full minute, swipe again. A magnet should be used by law enforcement officers, by first responders as part of seizure first aid for people with epilepsy in custody who have this. There's also an RNS, a responsive neurostimulator, which is placed surgically into the skull. Electrode leads wires are placed under the bone in or on the surface of the brain where seizures start. The device continuously monitors brain waves and can deliver stimulation when a seizure is detected. So it's able to detect seizures and then deliver stimulation. Now, use of a taser. Use of a taser may disrupt the normal function of an implanted device. Many people are not able to respond verbally and may act confused or not respond at all during a seizure. Check their awareness and ability to respond before using aggressive or unsafe measures. And avoid restraining a person during a confused state to avoid causing further agitation. Suicide, unfortunately, has higher rates in people with epilepsy. SUDEP, which stands for Sudden Unexpected Death of Someone with Epilepsy Who is Otherwise Healthy, is a leading cause of death in people with epilepsy. No other cause of death is found at the time of the autopsy, and the highest risk is with those with tonic-clonic seizures and seizures at night, or what we call nocturnal seizures. People with epilepsy may be found dead in bed, usually face down if they had SUDEP. Only 1 in 3 have evidence that seizure may have happened, and possible causes of SUDEP include changes in heart rhythm, respiratory arrest from suffocation or impaired breathing, and electrical shutdown of the brain. Concerns with death in home, be aware of the grieving process in sudden death. Respect the family's concerns. Don't initially react as if a crime has occurred. Be responsive to family. Be familiar with local services for bereavement support. Consult with a medical examiner about the possibility of SUDEP or suicide. So this is the experience of one person. My husband told the officer and the ambulance crew that I had epilepsy. Instead of peacefully resolving my seizure, they were determined to get me on a gurney. I was becoming more distraught and ended up kicking the police officer. He then said they would handcuff me, and they did. This person is not aware of what's happening around them, is not in control of their body while a seizure is happening. If you're too aggressive, or if you try to restrain them, they may react. Simply the body's fight or flight reaction, not intentional towards that officer, that ambulance crew, that first responder at all. If a person with epilepsy is arrested, arresting officers should notify jail staff if seizures or epilepsy is suspected. The person with epilepsy must have access to their seizure medication. Failure to take medication on time may precipitate nonstop seizures that can be fatal for that person. Allow contact with the person's doctor, and seek prompt medical attention if seizure happens while the person is in custody. After a seizure, drivers may be required by law to voluntarily turn in their license. If loss of consciousness or apparent seizure has occurred, law enforcement may file a driver condition report. Eligibility and renewal of driver's license depends on state laws. So here in Florida, the law is that the person has to be 6 months seizure free and may need to submit a physician statement. In addition, here in Florida, mandatory reporting by the doctor is not required. Medications or other conditions that affect a person's ability to drive may be a concern for anyone with or without seizures. Remember, if someone is having a tonic-clonic seizure, assist the person to the side and ensure the airway is open. Post-seizure period, what we call the post-ictal stage, can often mimic intoxication, drug abuse, behavioral or emotional health problems, and evasion. Seizures are more common than you think. 1 in 26 will develop epilepsy in their lifetime. Local Epilepsy Florida offices throughout the state can provide medical services, case management, education, and community resource referral to people with epilepsy and their families. Here's our contact information. Please reach out to us if you or anyone that you know has epilepsy. We would be glad to be able to help you. And here's a link to the quiz. Now for the quiz, if you score 80% or more, you will receive a certificate. So please put your name as you would like for it to appear on the quiz. Please also include your email address in the appropriate field so that the certificate can be sent directly to you. I've also included a link to 2 videos to show you what a focal impaired awareness seizure may look like and how you as a first responder, you as a law enforcement officer should respond to such and what they may look like when the person is in your custody. Thank you for your attention and for helping people with epilepsy and their families. If you have questions, if you or anyone you know has epilepsy, please reach out to us. We would love to help you.